just made a surprising discovery in the death of 5-day-old Tamara Taylor. The lacerations on the infant's face were not caused by the mother's fingernails.
These were absolutely, without a doubt, caused by a rat biting the body.
It is so hideous to think that rats attack this baby. I've never had a case personally where the baby was killed by the rat, but I know it occurs. It's in the literature. There are cases of this. They have very sharp incisors, and they actually can cut the skin. They can puncture vessels, and they can cause enough blood loss through their bites to truly kill an infant.
Detective Fuller is completely floored by the news.
This child was bitten numerous times by this rat. Horrible bites. Not just nicks, they were horrible bites. You really get angry that the baby went through this much pain. A 5-day-old baby does not deserve this.
And the horror of these specific injuries raises a whole new suspicion: criminal neglect.
Why didn't she wake up? If she had nothing to do with it, why didn't she wake up when the baby was crying? I mean, did the mom go out that night and leave the baby alone?
Detective Fuller immediately heads to Amber's house for another round of questioning. But when he tells her what happened, she's in total shock.
To hear that your baby had bite marks, to have a baby be tortured like that, it just killed me.
Amber blames her inability to respond on the pain medication she was taking.
I basically hated myself because I thought maybe if I could wake up out of the sleep that I was in for taking this medicine, that I could have stopped it.
Back at the morgue, Dr. Prallo must now answer some key questions. Did the rat kill Tamara? And if so, exactly how did she die? His findings will be critical to determining whether Amber will be charged with criminal neglect. As a first step, Dr. Prallo must consider the evidence he's gathered in the external autopsy thus far.
When we see blood associated with a wound, it means more often than not that that wound was bleeding.
And wounds only bleed when a person is still alive.
So in this case, the blood led me to think that they were antemortem wounds, and that's just a fancy way of saying that they occurred prior to death. It was disturbing, thinking that these may have been inflicted during the life of this infant. Rat bites could kill the infant in a relatively quick fashion, and that would almost have to involve the baby bleeding to death from these injuries. So I needed to know how much blood did this infant lose.
But to find out, Dr. Prallo must look for clues outside the body.
The clothing, I think maybe a blanket, came with the body, and there was blood on those items. We then asked for the additional bedding that had not come in. So there was a pillow involved, a sheet on the bed.
Next, he contacts the crime lab and asks them to measure the amount of blood that has soaked into these items. Their analysis yields a surprising result.
They were able to determine an estimate of about 4 cc's, 4 milliliters of blood that had soaked into the clothing and bedding that was there. So it was not a whole lot of blood that was lost.
In fact, the blood loss is so minute that Dr. Prallo now questions whether the rat bites could have killed her at all. To be absolutely sure, he must turn his attention once again to the newborn's wounds. And it isn't long before Dr. Prallo recognizes a pattern that wasn't obvious when he first examined them.
it became readily apparent to me that the reason these rodent bites looked like antemortem injury was because a majority of those bite marks on the infant's face were on the right side. So with the baby on her back and her head turned to the right, the blood will begin to settle on the right side of her face based on gravity. So if injuries are made even after death, they can have the appearance of antemortem injuries.
For Dr. Prallo, one thing is now clear. The rat could not have killed Tamara because the newborn was already dead when it attacked her. And Detective Fuller has a theory as to why.
Possibly some milk residue was still on the baby's mouth. And possibly this rat walking around the bed, walking around the baby, smelt the milk, and that's what caused the rat to bite the baby.
Though disturbing, the finding does provide a small comfort.
Finding that the baby was already deceased at the time of the rat attack eases a lot of pain and anger. It's a relief that the baby didn't go through any pain.
And suddenly, Amber's entire story is seeming a lot more credible.
It clearly explains why the mother wasn't awakened by any cries or screams.
But what it doesn't explain is how Tamara died. Now, back at square one, Dr. Prallo wonders if he'll ever find an answer.
A vast majority of the infant autopsies that we perform, the cause of death remains to an extent a mystery. In most instances, the babies are dying from something that we call sudden infant death syndrome.
Sudden infant death syndrome, or SIDS, is a conclusion that all medical examiners hope to avoid.
SIDS is a totally unsatisfactory diagnosis because it's basically saying we don't know why the child died. We have done exhaustive testing. We've done an exhaustive scene investigation. We've done a complete autopsy. We've looked at the tissues. We've done microscopic examination. And after all that is done, we still have a dead infant with no good answer.
So Dr. Prallo will now be on the hunt for anything and everything.
In a baby this age, I will be concerned about congenital problems, some underlying natural disease, infectious disease, or something that's traumatic.
He starts his search with the infant's head.
There was essentially no injury internally. There were no skull fractures, there were no facial bone fractures, there was no bleeding around the brain, there was no brain injury whatsoever.
Next, he examines the baby's internal organs.
There were no injuries of the internal organs. Everything looked essentially normal.
That is, until he gets to the lungs. They should appear light pink with a spongy texture when healthy.
The lungs had a firm consistency. They were discolored, a little more dark than normal. Something was going on in the lungs, but I couldn't say for sure.
When you do an autopsy on an infant, you know, they have the tiny lungs, and it's difficult with your naked eye to really tell what's going on. To really determine the cause, you have to look under the microscope. It's essential for an infant autopsy.
Dr. Prallo carves tiny slivers of lung tissue and sends them to the lab for processing. When the samples finally return, he wastes no time slipping the first one under the magnification lens. Slowly, an image comes into focus. And in an instant, it spins the case in a whole new direction.
You don't take everything at face value. Everything isn't necessarily what it seems to be.
Yes, this is Dr. Prallo.
Got to completely change your thinking about the whole thing.
I didn't know exactly what was going to happen. I just prayed. I know God will make a way, and I know He doesn't put too much on a person that they can't bear.